Hello, everybody, and good to see all of you-ish. Sorry I'm not there, and I hope everything's going great with the diplomat, and I miss you guys. And anyway, you all know me. I'm Dr. Josh. I wanted to talk about cone beam CT with you guys for a little minute. Tyler asked me to share some of my experience because I've been doing this for a while. I did traditional x-ray for the first 5 years of my career at the Pierce Clinic of Chiropractic. We were doing advanced orthogonal. We would do, the four typical, the nasium, the horizontal, the lateral. And I did that from 2014 to 2019. And then in 2019, I moved to Santa Barbara where I didn't have an x-ray machine. But I had seen Jake Hollowell's presentation on cone beam CT analysis for Blair. And I was like, orthogonal needs to be doing this, but we just didn't have the technology and nobody was doing it at the time. So in 2019, I started asking a dentist to send me some cone beams, and I started playing with them, and I started piecemealing together an orthogonal based analysis. And it was very difficult. I was using several different tools on my computer, like a measurement tool, an angulometer tool, just different things that would overlay on top of the cone beam that would allow me to measure the slopes and the C over A, because those softwares they're not built into the Radiant software. And so I ended up creating a program called Toolkit, and I'll open it up and just show you real fast. If this is a cone beam, this is the Toolkit app, and when you click it, it's just a screen overlay tool that has, all of our traditional measurement tools built into it. We've got angles, we've got a cephalometer, I've got a center point tool, and then we've got a calculation box over here. And so I'm just gonna go over a case with you guys to kind of show you how I look at cone beam CT imaging. I got my machine officially installed about 2 years ago, and it's just been such a game changer because it used to take me, I say, 30 minutes to get 4 blurry x-rays, and now it takes me 30 seconds to get unlimited x-rays. I mean, CBCT is just so much information. And so I use Radiant, which is very cheap. It's like $50 a year for this imaging software. And I have 2 options here. We have NPR or 3D. And so 3D is fun. You can see a lot of cool things in 3D, but you can only see really the outside of the bones. You can't see the inside of the bones. And yeah, you guys are gonna see why I wanted to share this case with you. This is a very interesting neck. All right, if we come over to the NPR view, we can see slice by slice. We can't see the thing as a whole. We can only see slices. And part of me thinks the human brain likes to see things in 3D, but we get more information looking at the inside of the bones because you can't see all of this hardware on the 3D. And this woman came to see me about a month ago. She's got a big old nasty 4-level fusion. Let's get right to the middle of it. This is what I don't like seeing. Right, you've got C2 falling off the front of C3 right here. No curve whatsoever built into the spinal canal. C3, 4, 5, 6, and 7 are all connected. There's a C7 block there. And so she came to see me because she's having a lot of neck pain, understandably so. And I just kind of want to go with you guys step by step how I'm currently analyzing these scans for analysis. And I'm going to preface with how I'm doing this is not necessarily the best way of doing it or the only way of doing it. It's just after 5 years of doing it, this is what I find works for me. And I think that we need to continue to work together as an upper cervical community to understand how's the best way to be interpreting these scans. So I usually start my interpretation in the 3D mode, because there's some things that you'll just see better in 3D and some things you won't see until you're in 2D. And what we do is we are going to do the positioning of the imaging in the software, in the Radiant software, and then when we're ready to measure, we're going to open up Toolkit to overlay, grab those numbers, and put them into the calculator. So here I want to take rotation out, and we have all these different tools here. I'll left click to assign one to the left click button, and then I can right click to assign it to the other button. And I want to unrotate this skull. So Radiant's got a great feature where it's got the coordinates mapped out here, and I know if the coordinates think she's at 0, it actually looks like she's rotated off to that left side. And so if I click a few times, I'm just trying to roughly unrotate the skull, so I feel like I've got a really good A to P view, no rotation. So I did 3 clicks, it's 3 degrees rotated. And in traditional orthogonal, to measure if we had a rotated skull, I try to do things as traditional as possible, kind of honoring the ways of Grostic. We would be measuring points kind of like this and this. And if they were close, and they're pretty dang close, then that means they're not rotated. I'll take it one more click over to see if it's closer. 1.8 and 1.89. We'll say 4 degrees of rotating the film this way is going to give us a perfect A to P, and that means if we take it from the back, then we would have to rotate it 4 degrees the other way to be seeing it now P to A, no rotation. And that's, the imaging you would be doing in the chair with the patient. Now we're able to do it so much easier in cone beam with just a click of a button. So you can see if we took the analysis at this angle, we would see maybe more C2 rotation than if we actually did the analysis at that 4 degrees, 176, that's straight. And so let's go ahead and zoom in on this posterior arch. And to get our S-line, we really want that posterior arch and the anterior arch to be overlapping. So here's the back of it, the front of it. I just tilt it a little bit like that. And then we play with the density till we can really see a lot of what we're trying to measure. And so, putting pathology aside on this case, there may be bone whittling. That's not what we're here to do today. We're just here to get our measurements so we know how to do an analysis. And traditionally, we would mark this posterior arch to get our plane line. So I'm going to open up the toolkit now, and I have I'm going to change this to the language of orthospinology, where we have hopefully terms everybody's familiar with, like laterality, which side has the atlas gone to. Lower angle is going to be in an orthogonal model, the bottom of the neck versus the atlas, how is that bottom doing? Atlas plane line is how tilted is the atlas, and then C1 rotation is how A to P is it on the side of laterality. And then axis spinous is going to say, is that C2 spinous tilting off to the right or the left? And so we're going to measure plane line, and the way I do that is I put the HA, the horizontal angle tool, over here and over here, and I try to see if I can measure a line that I feel comfortable about being my plane line. And that's pretty good, 3.8 degrees high on the right side. So here in the calculator, we have superior lateral mass, inferior lateral mass. That's referring to the top of the atlas, which would be a measurement kind of like this and this. And the inferior lateral mass would be the bottom of the atlas, looking like this and this. And, in advanced orthogonal, Dr. Pierce says they're different. We want to do a best fits model. And right now, a best fits model looks like it'd be, pretty close to that 3.8, because this high 2 degrees on the top of it kind of is an outlier. So we would, in advanced orthogonal, we would throw away this measurement since it's not matching the others, and we would use this as our plane line. And I created this idea that what if we measure the top of the atlas and use this for our upper angle, and what if we measure the bottom of the atlas here and we use that for our lower angle, and we threw out this plane line measurement altogether? And that's why I put it into the calculator, where you can break it up. You can say that the top of the atlas is high on the right by 2.07 degrees, and the bottom of it was only high on the right by 3.88 degrees. And that way you can break it up into what I call the triple plane line model. But sometimes I want to just be traditional, and I don't want to make things too complicated. And so I could just do it the old way. We take this plane line of 3.5 drawn on that posterior arch, and I'm just going to put that in for both 3.5 and 3.5. And that way we just have one plane line to work with. It's kind of the traditional way of how we measure plane line. And so that's kind of how Calculator works, is we're just going to fill out all of these boxes from top to bottom. And what the machine is going to do is it's going to say, well, if this is high, 3.5 degrees, and then later we're going to measure head tilt and see if that is tilted any direction, and they will put that in this box. And by comparing those against each other, we'll be able to determine a laterality, a lower angle, everything. And so I try to create this in a way that was similar to VizTech. You know, I used VizTech for a long time, and I didn't want to just import things into VizTech, because then it was screenshot, import. It would take too long. What's nice about the way the toolkit is built is if something's kind of blurry on the right side but clear on the left side, I can minimize toolkit, I can just slightly modify that density, and I can open toolkit back up and see if it's still good. And so by being able to kind of jump back and forth into the viewer, we can increase the amount we're actually seeing of the cone beam, the amount of data we're getting, and that's the whole point of cone beam. So anyway, the next thing we're going to take a look at is going to be that axial circle. All right, we want to look at the C over A in orthogonal work, and here is the top of the axis, and it's a really good place to view it. I feel like in 3D you can see the whole C2 at once, and so that's why I always measure my axial circle in 3D, and I'm just going to prepare for imaging. And the angles I choose are ones that kind of give me like a straight surface of that axis, whereas if we were looking at it, you know, more at this angle, we see the front of the body there, we see the back of it here. I want those really to be more overlapping. And what we do is we're going to drop a measurement bar that's flat of any length, and we use this to help calibrate my toolkit. And so we'll open up toolkit again, and we'll put the calibrate button right there, and we're going to go ahead and just put that on top of this and teach the calculator, teach the toolkit that the length of this bar I'm drawing is 4.07 centimeters. And okay. And so now that the toolkit has a size reference, since it's a separate program than Radiant, now I just press the axial button, and I can go button here, button here, button here, and a little button here. And the size of that average ring is 4.94 inches is the diameter. That's what we would consider the axial size. You know, and 3 over 5 is kind of what you expect. That's what I tend to see on cone beam, is in that range. So if I feel good about that, I hit this auto load button here, and it just kind of carries that number into the axial button right there, and I've got my axial surface. And I'm going to look at that again later in MPR when we look at the condylar circle. It's just kind of difficult to measure that condylar circle in 3D, because if you look at it right here, you know, it's kind of looping up the back, and it's kind of hard to measure that. So anyway, what we're going to do as the last thing is we're going to get our lower angle off of this 3D, because you can see the whole dang neck, you can see that's shifted to the left. And traditionally we would mark the top of the dens, but it's covered by bone. And so what we're going to do is we're going to take it from the side, and we're going to use this scalpel tool here to amputate that posterior arch off. And when we come back to that posterior view, 4 degrees of rotation for straight P to A, now I can get a really good shot of that whole neck. So we're going to open up toolkit, clear all. I've got a center point tool here to mark the sides of the dens. I'll put the center point of that on the center point of the C2 spinous, which is how we would do it, I believe, in traditional orthogonal. This is how I was taught to do it in AO, is you find the middle of the neural canal up here, and then down on the bottom we can mark the sides of the spine, something like that. And you know, we could even do the size of T1 if we wanted. And again, how it's kind of transparent here, it's a little burnt out. What I do is I just jump back into Radiant, increase the density so I can see what's going on down here. Now it's covering, but I already marked it. It's all in the same place. And I can choose to do another center point here at the bottom of that C7. So we'll use the vertical angle tool here, and if we put it on this upper point of C2 and the lower part of C7, that should be kind of like the average tilt of the neck, which is 6.36 degrees tilted to the patient's left. So we'll put that into the cervical spine. It's tilted to the left, 6.36. And if we compare that to that 3.5 plane line, it gives us a lower angle of a right 2.86. And that's going to be our first measurement, actually, or that we compare angles. And in orthogonal, we don't want a acuity, right? We want everything to be 90 degrees. And so we'll be doing positioning and adjustments that help open up that lower angle, get the head more square. And this is pretty much most of what I do in 3D. We'll come back to this at the end. But now I jump over to the MPR viewer, because I believe that the rotation of the atlas is a lot easier to see in slices like this. So what we're going to do is we kind of get this centered with the skull, and I kind of loosely start to rotate it like this. And you kind of have it kind of going straight through the atlas here. I put it right on the middle of that C2, and I start to scroll up into the skull to see, can I get this center line to kind of go through everything together. And I'm looking to see if it's going through with internal occipital protuberance, and really through like the tip of the nose, and then I like it when it's between the teeth. That looks like a little too much. And I'm just trying to roughly get this straight through the skull. And the second way that I check that is that I'll kind of scroll through it here, slice by slice. And as we come slice by slice, you see how this mastoid is appearing before this one on the right side, which would kind of suggest that it's a little rotated still. And if we come all the way up to like the jaw or the eustachian tubes, do those look like they're opening up? Or that internal ear canal is what I mean. And then do the jaws appear at the same time? And people could have jaw misalignments that affect that. So I don't put all my money on the jaw, but then here on the eyes, do these orbits come in at the same time? And no, not even these come in together. So I'm just going to try to even this out a little bit. And now as we scroll through, now the orbits are kind of closing together. As we go a little bit deeper, now the jaw looks like it's appearing more on the same plane. Yep, see, it just pops into view right at the same time. And if we look at those inner ear canals, these should look like they're kind of like the same size as we scroll through it. And this is how I'm assembling my horizontal skull line. And once we have that, then I scroll towards my atlas, and I'm going to position this more to sit kind of on top of that atlas like that. And that way, as I start to look at this horizontal slice, and we start to come down into that atlas area, and you see the condyles of the skull right here, foramen magnum, we come a little bit lower, 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 and we see that atlas starting to appear and jump out at us right there. So the way we start to measure our atlas rotation now is going to be, we're going to open up the toolkit, clear all, and I have a protractor tool here that we're going to place on this blue line, and that's going to represent the middle of the skull, and we're going to get that just perfect. That looks pretty good to me. And then we're going to place this other line on our atlas. And there's, there's a million ways to measure this. And the more you measure, the more numbers you get. You kind of just want to pick what looks best, feels best, agrees with most of the structures, or else you'll drive yourself crazy on cone beam, right? That's the good and the bad of cone beam. You can see more, which means you can measure more. When you can measure less, you got something faster, but it wasn't necessarily the truest representation of what's going on. And so I kind of start by just putting this onto the TPs, the wings of the TPs, to see, is that atlas rotated at all? And then I'm going to close this, scroll till I just see like the backs of the joint, and match it with that. And is it going on the back of the atlas joints? See, now it's gapping a little bit. I'm going to take it up a little bit more. Let's see if that is just kissing the back of the atlas there. That looks better as it comes through the back. And then I'm going to jump back into the image, scroll to the bottom of the atlas. These joints are a little bit easier to see. Open up toolkit again. And again, can this go right through the back of the atlas? Let's go through the TPs, and some techniques are going to look at these foramen right here. And if you want to be Nuka, you could put center points in the middle of those. I believe this is how Nuka does this. Put this right here and measure your atlas rotation like that, which would say, roughly anterior on that right side by close to 4.5 degrees. And so I used to, be a stickler, 4.66 degrees exactly. But at the end of the day, the difference of 4.5 versus 4.66 in the calculator doesn't really change your adjustment at all. So I tend to round these days as I get older, 4.5 degrees anterior on that right side. And so in the calculator it says atlas anterior on the right side, and we're going to put 4.5 degrees. And the calculator is going to say, okay, if we look at laterality, which we think is a right side, then it's a 4.5 anterior. But if the calculator sees that the laterality is a left side, then it's going to change that to a posterior 4.5 on the left. We don't know the laterality yet because we haven't measured head tilt. That's why we only have 2 measurements left to go. We have to do C2 spinous, condylar circle, and head tilt. So 3 measurements left to go. So while we're here, what we do next is C2 rotation. And I bring this DENS up towards the top of my screen, and then we're going to move this out of the way a little bit. And we're going to put center points onto that DENS. And we're going to put this protractor tool right onto the middle of that. And then we're going to jump back over to Radiant. And we're going to scroll down until we can see that C2 spinous over here. And if we open up Toolkit again, we'll swing this onto that C2 spinous. And when we look at that acute angle, we'll see that this patient's C2 tail is spun off to the right side. Here's the left. The right side by 9 degrees. That's what you would need to get to 180. And so we'll put that into the calculator, and it's going to convert that into into C2 spinous 9 degrees right here. And so let's go ahead and minimize that. We're kind of done with rotation. We need to look at our condylar circle, and we can scroll pretty clean up until we see our atlas, and here's the base of that condylar circle. And so we're going to go ahead and just kind of get this ready for measurement. I usually leave this kind of like right through the atlas there, and then I'm going to open this up and get a nice zoom in. And we kind of scroll till we find a slice that looks like we'll be able to get some really good symmetrical measurements off of, and we'll drop a line for calibration. We'll use the calibrate tool here to teach the toolkit the length of this line. And then I've got a C button here for a condylar circle. So we put those buttons little here and here, here and here, and it will kind of give you a calculation that that condylar circle is 2.78. We can use the auto load button to lock that number in. And if you're not totally crazy about it, if you want to look at a little bit more data, you can jump back into Radiant, scroll a couple slices deeper, open it up. Invariably, it's always going to be a little bit different, and then you can kind of modify these points to where you see things now. And if it's a little hard to see, I have a transparent button here that can kind of make these tools a little bit more see-through for fine-tuning. So I still got a 3 on that condylar circle. That's about what I would expect. If we hit auto load, there it is, and we are kind of done with that. So the last thing we're going to measure is head tilt, and the way I'm currently doing that is kind of again doing a best fits line using this yellow bar right here. And we'll start by just kind of dropping it on the tips of the mastoids like that. And then we'll scroll a little bit deeper, And we're looking at different internal structures of the skull here to see, can we get this to go right through the middle of that brain, that so here's on the bottom of the skull here. Maybe a little bit less. Try to get it to sit in like the top of that jaw joint. So actually maybe a little bit more right there. Make sure this is kind of right under that zygomatic. That looks pretty good there. And then I'll come all the way up to the front and see if it's kind of going straight up that sinus, right through there. And is it going right through the front of those two teeth? And yeah. And so once I have what I feel is pretty good rolling through all these different skull structures, and these blue and yellow bars are right on the skull, then I'm going to use that vertical angle tool from earlier and measure that this head is only tilted to that left side by 1.68 degrees. So we'll put that in right here. And that is currently how I'm getting that head tilt measurement. You could do it many different ways. You can jump into 3D and you could try to do a similar subjective measurement like that. We said 4 degrees. Looks pretty good to me. You could drop some center points on the side of this skull and see if you can get those to agree. That's pretty dang good. And Dccjp with the NUCA group asked me to build a cephalometer tool. So you could even take this box and kind of drop it big, rotate it around with your arrow keys, slide it around with your arrow keys, and when you think it's kind of going through the middle of that skull, then enter, and it will give you a kind of a central skull line again. And so we have all of the boxes filled out, and that gives us our listing right here, where the laterality is to the right. It is a lower angle on the right. The plane line is 3 degrees. It's anterior 4.5 degrees. C2 is swung 9 degrees to the right with that atlas rotation. We've got roughly a 3/5, and then lower angle in orthospinology is kind of the tilt of that neck, and we measured 6.3. So I will reconstruct all of this for the patient with a tool called Show Misalignment, where you kind of bring the patient like this, open up the toolkit, and you hit Show Misalignment, which will take these measurements and recreate these lines out of them, where if you put it kind of right in the neck, right in the skull, you get to see what you're looking at. And so I'll save a picture of that. We have a snipping tool right here, and we'll say this is patient X. And I'll use these in my report of findings, I'll show you in a minute, to try to present to the patient. I like to look at this before I adjust to kind of get, okay, look at how much tilt there is to the left. If we take the head piece this way, if we tilt the head piece this way, if we bring the shoulders, it helps me visualize my adjustment before I do it, which I really like. So I have a calculate button built into the orthospinology tool. And so it's going to take these measurements, and if you hit calculate, it'll give you your height factor, your RA, and your RF, which is, I believe, everything you guys need in orthospinology. I usually do all my measurements in Epic, and in Epic we have a button built in called Sonus. And Sonus is a software James Beadle built with a friend of mine that basically is just going to copy these measurements to the clipboard. And I'm going to open up Sonus right here. And you basically just make a little file for them, patient information, we'll just say patient X. And then on here where we put our measurements, I'll just paste it in right there. And we'll say today is 5/30/2025. Cool. And then in this digital patient viewer, we can roll down to patient X. Not there. Let me try to get all the way up here. Don't look at my HIPAA names. There we go. Sonus will take those measurements and create this little formula box, kind of like this. And what I like about this, I've been using Sonus for a couple years now, and it shows you, what their listing is: right upper angle, right lower angle, anterior on that right, C2 right, height plane line. And then these are going to be the measurements we would use in orthospinalogy, or ADVO or EPIC, is 15 degrees on the Z and anterior on the adjustment by 17 degrees. And those are the coordinates I'll be putting into my machine. And then here is the setup I would be using. So I'll grab a picture of this. I'll grab a picture of their show misalignment. And then the last thing I'll use is I'll take a look at their TP. And so if we roll over to TP, over on the side, we know that this patient is a right listing. So we're going to take a look at that right TP. And it's so beautiful and easy to see in 3D. I have a freehand tool right here. What I like to do is I'll freehand kind of their jawline. I'll make that a little bit thicker. I'll freehand the patient's jawline right here. I'll freehand right around where their transverse process is, and then I'll draw around their mastoid. And then I jump back into Radiant and I fill in the density until I can see their ear right there. Here's the clamp from the machine. And if I jump back over to Toolkit, then I can see where that mastoid is, where their jaw is, where their TP is, where their earlobe is. And I'm really looking at all of that when I'm aiming my machine right to make sure it hits that TP. And of course there's going to be 1 to a half inch of soft tissue between that TP and the surface. So I'm not necessarily going to have the machine right over. I'm going to have the machine usually up in this area if it's an anterior, or up in this area if it's a posterior, to make sure that my ray is kind of coming straight at that TP. Cam Bearder and I can fight about that one all day. But that's just how I've been taught, and that's how I've been doing it for 11 years, is shooting to aim at that thing using a sound wave. And so once we get a screenshot of that, here's a snip tool right here, we can grab a screenshot of that. Then I assemble all of it into a PowerPoint. And so every patient gets a PowerPoint, and here's this patient right here. And you can kind of see that this is what I first measured on them. It's very similar numbers, 3.4, 3.5. I guess we measured a little bit more atlas rotation, but everything else is pretty similar. And what I like about this case, is I told her, I said, it's a pretty bad fusion, but we're going to do an adjustment on that atlas, try and bring that plane line down. And we did one adjustment on her, and she's been holding all the way up to today. We checked her, she's still holding today, and she's doing really, really good. She's a testament that you can adjust patients post-fusion and just be gentle with it, and they can improve. I've seen it before. And so just a crazy case with all that metal that I wanted to share with you guys. So anyway, I hope this has been helpful. This is how I do cone beam. That's how I've been doing cone beam. My software, you can purchase the software on my website, you can message me. And then I'm partnered with Josh Markovich, and I'm partnered with Anode, and I'm partnered with Chris Thornsberg. So basically, if you buy a cone beam from either of those guys and you're in the orthogonal world, then usually my software is kind of wrapped into that, and my training is wrapped into that, because it's kind of hard to measure these and get your coordinates without that. And that's why I created this software, was not just out of my own convenience to get analysis done quicker and more accurately, but really to try to make a tool so that our whole profession could move into the future of imaging, which I strongly believe is cone beam CT. So if you guys have any questions, you all know how to reach me on Facebook, and I hope you guys have a great seminar.